Welcome everybody to the 131st episode of the Crisis Jam here in June of 2023. We are going to have such a great jam today, and Susie Reese is going to be our featured presenter. You've seen her before, but she's back today to talk a little bit about the initiatives they're doing around lived experience at the Suicide Prevention Resource Center. Can't wait to get to her in about 5 minutes. Let's start off with some quick news items. Remember, you can always go to our website, Crisis Talk, where you can learn everything about the Crisis Jam, what's coming up. The Zoom link's right there if it's fallen off your calendar. You can see who's upcoming. You can revisit what happened last week. It was a great one last week. If you missed it, go back and visit it. And we also have now pulled up all the old ones from the very beginning are on there too. So there's lots of things that you can go back and visit. So know that that's always there for you. So who's watching? Who's seeing us live? Remember, we've got this nice slide. Our youth edition still's at the top of the pile, but our one with the kickoff with Miriam Delphin-Rittman and some of our other ones about tech and crisis receiving centers are still high up there. I always love to see, even though YouTube, look at how big YouTube is, and overnight we breached over 1,000 YouTube subscribers to our channel. So folks, you are not alone in wanting to see what we're doing and what we're thinking about on the Jam. And I'm so glad to be part of this community. Coming up, July 12th, I know I'm ready. We're going to be having the big birthday party with Monica Johnson here and a bunch of surprise guests. This is where I think you might want to consider how many speakers we've had. But it's going to be a fun one. And I know David Covington and his team are going to be putting together some amazing things for that session. So definitely put it on your calendar as a star. You don't want to miss it. So a little bit of news. 988 SAMHSA Group is taking it on the road. Today, they're in Austin, Texas, but here's a picture from them recently in Georgia, where they're going around and listening to folks out in the field. What's going on with 988? What are you feeling? How can we make it better? How can we be good partners in this effort? So we'll be hearing more about this road show, as I'm calling it, in the next coming weeks. But no, today they're in Austin. So if you're in Austin, they might be there. Now, you may not know this, but I am a big voter on the SAMIs. And as you know, the 988 team here with James Wright, Richard McKeon, John Palmieri, representing all of us who are behind them, showing the government that we believe that 988 effort is one of our most important things that we should be voting for. You can vote every day. I have paired it with something I do every day, which is get a hot tea in the morning. So hot tea, vote for the SAMIs, and then I move on. Our team is already in the top 12. Top 6 is going to be announced on June 20th. So now is our time to do a big final push to get them over into the top 6. So please vote for our favorite team for a SAMI. SAMHSA has just released their new data on lesbian, gay, and bisexual behavioral health. This is important information they've been collecting over time. And something we should all be looking into. That's available on their website, and I encourage everybody to go check it out. So this is Randy Killings here, and he is the Director of Peer Services at the Rainbow Heights Club. And here's a production that's put together by Nashbit and the Rainbow Heights Club. And we're going to be showing maybe a little bit of this during the preview of next week's jam. If we don't show it then, I just advise you to just check it out. It's really good. And the Rainbow Heights Club is in Brooklyn, and they are really behind innovative, affirming, and effective treatments and support for people with LGBTQ and mental illness. A great place to learn about if you don't already know about them. Every week, we always talk about this. You may be sick of it, but it's still important. Remember that there are free things that you can put in your clinic, your waiting room, around to let people know about 988 and that there is hope and there are people on the end of the line who are professionals who can help them when they're in a crisis. So still encourage you to visit the SAMHSA store and get some items for the place where you work. always encouraging getting their t-shirt. I've got my 988 t-shirt on today. I'm in a different place for the summer, so I've got a new audience on the streets looking at my 988 shirt, which thrills me to no end. T-shirts, hey, maybe you still live in a cold place and you want to get a long sleeve one. We still got those as well. So feel free to get your 988 new shirt. And now we are up to the hot seat, one of my favorite parts of the jam every week, mostly because I love to play the game. I'm not an often winner, but I like to play it. So wanted to call Jenna up. Are you here, Jenna?
Yep, I'm here.
Wonderful. Do you want to introduce yourself to our audience?
Sure. I'm Dr. Jenna Maynard Baker. I'm the policy director of OMSAS, the Office of Mental Health and Substance Abuse Services in Pennsylvania. I'm also on the board of directors of CIT International.
Wonderful. Well, I know we have a lot of people from Pennsylvania in the audience, but everybody's going to want to help you win this one. So let's see the question. So AI is coming. We know that, right? We keep hearing it. I know this is not it. Trust me, it's not an easy question. Experts predict, I'm sorry, David tries to give hard ones. Experts predict continuous advancements in machine learning, natural language processing, and computer vision, with significant changes for the way we live in the future and the way we work. So let me see this next part of the question. Experts predict the storyline here above could occur within how many years? So here's the headline. Helpline disables the chatbot because it was giving harmful responses after firing human staff. So the title here is that after firing human staff, they had the chatbot, but they had to disable the chatbot because it's giving bad advice. Is that something we predict we're going to see as a headline in 10 to 15 years, 5 to 10 years, 2 to 3 years, or hey, this isn't even a prediction. This actually is happening now. This is an actual story. So let's ask our audience. But while we're asking our audience, what are you thinking, Jenna? What's your gut feeling?
I'm going to say A, because I think that will take a while before we would give over something as important as, letting a chat bot give responses on a helpline.
Right.
So,
right.
And so I think that it would definitely take a while.
So David's advising you to phone a friend. Do you see anybody in the audience who you know?
Let's see.
Who would be a good person on our call today to chat with you about what might be a good answer?
I don't know. Well, David has an opinion, so maybe I should ask David what his opinion is.
Okay, or
what
Sabrina, about Sabrina?
Sabrina's on,
Sabrina Taylor, can we call you to the front?
Oh my gosh, I don't think I would know.
Yeah.
What was your gut reaction, Sabrina? What were you thinking?
So my first gut reaction was that it's not a prediction, it's an actual story.
Whoa, that's the totally different end of the spectrum.
But I don't know. I don't know if anybody's actually fired human staff yet.
Yeah.
Okay, let's find out what our audience says. Okay, audience. Oh,
so, Sabrina.
A lot agreed with Sabrina, not so much agreed with you, Jenna, but let's be honest, it was spread apart. What do you want to go with for your final answer?
I don't know, because my answer was definitely not right. And Sabrina's was shared by the most number of people, but I feel like, I guess I trust Sabrina a lot. So I'll go with D.
Okay, final answer is D. It's not a prediction. It's actually a current story. Oh my gosh, that was correct. Sabrina was correct. Now, Sabrina's not going to take your t-shirt. You're still going to get a t-shirt, so don't worry about that.
I already have a t-shirt. She can have it.
But Sabrina, good guess. So let's look a little bit more about it. So basically, here are the news stories. So there was a story in Vice and a story in Wired. And as David kind of hinted, looks like it was around a chatbot being used for eating disorders. And what I've heard is that the chatbot was actually recommending dieting. And so it really was kind of a disaster. So here's the New York Times article and then some articles here. But Jenna, thanks for participating today, and I agree with your head shaking reaction to this. It really is just not the way we want to go, and it doesn't feel right to us who really feel like human to human interaction is the way to help individuals. So thanks for joining us today, and the t-shirt is on its way.
Great. Thank you for the chance to join.
Sure. So yeah, a chatbot is just no substitute for human empathy, but I think we need to remember that technology is coming, and it's coming quick. And so we need to partner and think about how we can make technology support what we think is good care. So of course we can't just hand it over without making some influence on that. So I think this is, even though we're kind of like, no, there's no way, it's coming. So how do we make it the way that we want is kind of I think the way that we think about this. So I am thrilled to bring forward Susie Reese, Director of Lived Experience Initiatives for the Suicide Prevention Resource Center, and also an individual who's really thinks thoroughly about how do we, as humans, address difficult situations? How do we address difficult situations? So Susie, I'll hand it over to you. I'm really looking forward to listening to your talk today.
Thank you so much, Amy. I don't think I've had a better setup for my segment so far. I mean, talking about human empathy, that's exactly what lived experience work is, right? It's about connection. It's about how we as people can ensure that that piece of our heart is embedded in the work that we're doing so that we don't really step away from the importance of this and lose sight of where we're trying to go with our mission and our work. So as we get started, I do want to share a couple of disclaimers about the Suicide Prevention Resource Center, just for those who may be a little less familiar with our organization. We'll share some links in the chat as well so that you can find out more about SPRC. But really, when we do begin our presentation, the most important thing that we start with is our land acknowledgement. So I do want to take a moment and read this for all of you because it is something that really centers us and grounds us in this work. We acknowledge that the land that now makes up the United States of America was the traditional home, hunting ground, trade exchange point, and migration route of more than 574 American Indian and Alaska Native federally recognized tribes, and many more tribal nations that are not federally recognized or no longer exist. We recognize the cruel legacy of slavery and colonialism in our nation and acknowledge the people whose labor was exploited for generations to help establish the economy of the United States. We honor Indigenous, enslaved, and immigrant people's resilience, labor, and stewardship of the land, and commit to creating a future founded on respect, justice, and inclusion for all people as we work to heal the deepest generational wounds. So this is really everything that underscores the work that we're doing, which is acknowledging the pain that so many of us have experienced, not only in our lifetimes, but throughout generations, and working to keep that central in our mission and our day-to-day so that we don't lose sight of the importance of that human empathy element, which we were just talking about a few moments ago. So today, I know I don't have a lot of time to go over everything, so I want to give you a high-level overview of the work that we're doing at the Suicide Prevention Resource Center. First, I want to introduce you to the terms that we're using and how we define lived experience when it relates to suicide. I want to talk about our lived experience initiatives, essentially what our program focuses on, and I'll open it up to some questions in the chat and do my best to answer those questions if you can drop them into the chat because for the sake of time. So to get started, when we look at defining lived experience, we've had multiple conversations around how to define lived experience in our organization and with those that we work with. And we really came to a realization that we're talking about such a large field, and it's not necessarily our right as individuals working in suicide to actually define lived experience as a whole. So we realized that we were talking more so about suicide-centered lived experience. And then we're trying to determine what does that actually mean? And who has, for the most part, been excluded throughout this work? And how can we make sure that we're not doing those same things to be exclusionary? So these are the terms that we came up with. And this is attributed in part to Roses in the Ocean as well. But people with lived experience of suicide can include those who have had or currently or are currently experiencing thoughts of suicide, survived a suicide attempt, lost a loved one to suicide, or provided substantial support to a person with direct experience. A lot of the individuals that we work with are considered impacted friends and family, and sometimes we overlook their expertise in these spaces. And to me, our support networks are such a key element of lived experience, are they not? These are individuals that have been able to navigate difficulty and try and figure out how best to actually get people to the care that they need. And I think it's really important that we recognize that. So as we look at our program a little bit deeper and get into the next phase of our content, we are going to look at the overall program priorities of our actual program. So if we can go to the next slide, please. Thank you. And so there's 3 program priority areas for us as an organization. And the first is the development of an external committee of partners that essentially they help us and ensure that our work centers lived experience at every level in every project. I'll talk a little bit more about our lived experience committee and how they are truly impacting not only our work, but they are changing the culture of our organization without doubt. Then we'll talk a little bit about internal practices and external programs and how we can incorporate these types of practices into everything we're doing throughout the 988 system. So the very top to the very bottom should have lived experience expertise embedded. So as we look at the next slide and start talking about how we engage people with lived experience, you know, I hear the phrase lived experience, and almost always the concept of storytelling is just right there. It's so attached and it's so embedded. And as an individual with many types of lived experience, I know the importance and the value of storytelling. And yet I know we can do more in this work by encouraging individuals with lived experience to be seen as experts in their experience, not just in telling stories. So our committee of individuals actually really inform the work that we're doing. They get to put their hands right in the middle of every project that we're working on and within our organizations, and they help us. Really, they help guide us. So this can look like shifts in language. This can look like thinking in terms of marginalized groups and their specific needs that we really maybe haven't considered in different ways. They get to challenge us. And I'll tell you that that's one of the hardest things to really encourage when working with others is for them to have the ability to feel empowered to question or to say, you know, I don't think this is working for this population or for me as an individual with this specific type of experience. So if you notice, there's a lot of co's in our language: co-develop, co-design, co-deliver, co-review, because they are leading with us. We're not asking them as afterthoughts. We're not asking them to review and to give us feedback. We're saying, hey, we're thinking about doing a project. Can you get on board with us at the very beginning? Or do you have ideas? What can we work on? How can we empower you to lead with us, right? And then we incorporate those perspectives and ensure that our work is nuanced and has that complicated understanding of what humans are. That's, I think, what we were missing with that AI story, right? Humans are complex and there is nuance, and there are so many elements of lived experience that we often overlook or don't consider. So as we look a little bit more at our actual committee members, and this is one of my favorite slides that we can share, I'm just so grateful for the work that we're doing and for the individuals that I get to work with. You'll see a lot of familiar faces here, but you'll also see some newer ones. I know that in just a minute, we'll have a roundtable and we'll be able to spend a little time with Bianca McCall and Steele Kelly, Tori Shack is also on the call, but wasn't able to actually set time aside. So Tori, thank you so much for joining in. Tori is in Tahoe right now and has been sending me photos, and I'm so jealous. Not that I don't want to be here, don't get me wrong. But I'm just so eager to share these individuals because they are putting their hands on the work, they are guiding us, and they are consistently showing up because they are, able to actually find themselves being looked at as experts, which is how it should have been all along, right? So as far as our internal practices and how we make this action happen, we have had to develop a lot of different tools and strategies because, there are a lot of groups that have external committees and yet don't know the best way of inserting them into the work. And when you have such a large organization or system like SPRC or like 988, it can be very easy to have a committee that you're not accessing. And so we had to learn, like, how do we let our team members know about these individuals and really highlight their backgrounds and ensure that their intersectionality of experience is being considered and tapped into at every possible moment. And so we've developed all sorts of different tools, from tracking our overall engagement to really being able to look at the types of projects that individuals are working on, as well as even surveys or tools to access and get information about potential projects so that we can identify the perfect committee member for that project. So there's a lot of different practices that go into that. And then we're looking also at, how does this shift our organization internally and the culture? And I could say I've had multiple conversations. I believe I saw one of our BPR team members on earlier, and I've had multiple conversations with her in general, and specifically about just how we are developing a space where people lead with their lived experience. We are developing a safe environment where people feel as though that they can share their full selves. And because of that, our work is deepening and our work is more meaningful, not only as individuals, but as we really unveil it for everyone else to be able to access as well. So I'm not just telling you this as a person who is working for this organization. I'm telling you this as an individual with lived experience who's sat on committees, who's been asked to take a seat at the table, but not speak. Or when I was speaking, I wasn't necessarily being heard. And I think it's really important that we look at how we're developing our committees, how we're developing our work, and how this can inform the work and ensure that it has that human element that we so crave and really deserve. So the last piece of our program is external. And I'll be honest, we've had a priority project over the past couple of weeks. Some of you may have heard of the national strategies. So a few of these projects have been put on pause for just a bit as we work around the national strategies and ensure that that has the attention and time that it needs to actually really suit what everyone is looking for the next 10 years of this work. So we will probably towards the end of the year have a lot more tools that we're releasing, as well as different webinars and content. We're talking about developing one-pagers around safe storytelling, about how individuals can interact and be empowered and have agency when organizations or groups are reaching out and asking for them to be storytellers. Because sometimes as we're working with groups, we find that they want to really shape our narrative or shape our story, and that's not always what we're looking for. So how does this relate to 988? I think the important thing that we're going to take away today is the fact that, for one, we know, because we work with 988 so closely, that they are embedding lived experience at the very top, and they are working to ensure that individuals are there. But even at the ground level, even at the grassroots level, we need to make sure that lived experience is centered in this work, because it is the vital human element that is needed and that we all can connect with. And we know when it's not there and when it's not present. So I really want to encourage you all to look at the work that we're doing, learn more about it, and make sure that lived experience is always in the middle of your table and that it is empowered to speak and lead, because that is what we all deserve. So thank you so much for the opportunity to share a little bit about our work. If you would, just go ahead and ask those questions in the chat, and I will do my very best to answer them as best as I can. And I'll drop my email and everything else in the chat as well. I really appreciate your time and attention today, and I'm just so grateful to be able to do this work.
Susie, what a pleasure to have you on for a second time. There are a few questions in there, but I have a feeling more will come up. People were really focused on your talk. I'm going to call forward Steele and Bianca, who Susie already kind of introduced a little bit, but let's hear from them and some reflections on what you talked about today. Steele, do you want to start?
Absolutely. First, I want to say thank you so much for just allowing me to be a part of the conversation here at Crisis Jam. I'm a big fan of the work, so this is really an honor. I also wanted to thank Susie, SPRC, and just all those who are including us in these conversations and providing that safe space that Susie was talking about. It means a lot, I know, not only to me, but to others. I know that I'm probably one of the newest. I think that I'm one of the 3 newest LEAC members. So still kind of getting my feet on the ground, getting a little bit wet. But really, in my experience as a first responder, I live in a rural area, less than 1,000 folks. Volunteers comprise a lot of the services that are there. So this lived experience is just such a vital piece, because I see that like in my area in particular, and I think this is kind of the case across a lot of America, that there's a lot of first responders that they can use this lived experience, embed it, and use those expertise to fill in some of those gaps that are out there, especially with suicide prevention in particular. Often there's very little or no funding. We do a lot of our own work on whether it's a fire truck or things like that. So, having those individuals and understanding lived experience and being able to use that, I think is just a critical aspect. And Susie had talked a lot about that threading of the lived experience. I can see this being woven into, everything that I'm doing, and I can see it in so many other areas. So I'll pause there. I'll see if there's anything that Bianca wants to add to that comment, or if anyone else has any comments.
Hi, Bianca. Welcome to the jam.
Hello, thank you so much for having me.
Talk to us a little bit.
Yeah, no, I as I'm kind of coming into the conversation, thinking about how lived experience is just such an integral piece to positive outcomes, not only for 988 and I think throughout the crisis system. And when we talk about positive outcomes, I mean, we're talking about the utilization of the crisis line, also operating at a level 5 crisis system in any given region, and promoting resilience, right, and recovery and well-being of these communities, and lived experience by way of trained peer supports and that who are advocated in inclusive workforce environments that honors their experiences equal to traditional educational experiences. I mean, to me, those are key tenets in the process of creating these safe spaces for people to transition the conversations that they're experiencing with themselves, transitioning what has become destructive inner dialogue that's led to a crisis into a perceived or actual safe space, to process and to ultimately reframe and inspire to reshape self-perception in a way that there's hope, right? And there's improvement and self-identification and help-seeking behavior. And I also think it's important, to expand upon what Susie was saying, it's important to consider the targeted populations, for 988 and being those communities that are experiencing mental health crises at disproportionate rates. When we look at these communities, ultimately, I think that they demonstrated a level of resilience throughout a mental health culture, which has really forced them to overly rely on themselves and trusted members of who they consider family and community. And throughout my lived experience and professional career, I've developed or discovered a correlation between resilience and poor self-identification and poor help-seeking behavior. I've experienced this myself as a performer in sports, and correlated across, sports and military personnel and first responders, Steele is mentioning, and law enforcement, healthcare, LGBTQIA, and Two-Spirit Plus, young people especially. We're all conditioned to disassociate from painful experiences and any form of discomfort. And our self-perception is then shaped by our abilities to figure things out independently and from an isolated place. That's guided by that self-talk. So this is where, I believe that lived experiences, and this is who and how we see ourselves reflected in the person who's helping us to engage and to navigate a crisis system. It's not only one way, to do this, but I believe it's the only way to ensure the success and sustainability of our crisis system in 988. And again, just based on my own personal lived experiences and extensive professional experiences with mental health challenges and suicide, I've developed a supplemental health curriculum, that's available to high schools and colleges and universities and public domain workforce. And the curriculum, it integrates into a secure mobile application that was co-developed by Microsoft Technologies. And so since we were talking about technology earlier, I 100% agree. Technology is here, and we'd be surprised to the layman who's not involved in technology. We'd be surprised at how advanced technology and AI intelligence really is, and how close we are to having that level of response in our systems. But with our mobile application, it includes mobilizing community champions to serve as live moderators and group discussions and applications and analysis assignments. And we're leveraging the AI intelligence to support us as we identify these keywords and phrases and user behavior that can help us predict unrest and potential crises. And so, I think that, that matched with, predictive and prescriptive analytics and activities and thoughtfully curated content, it's important to be able to connect community members in real time to hyper-localized resources and helpers and healers from all sorts of determinants of health that are reflected, that we could see ourselves reflected in these people. Technology is here. Leveraging lived experiences is what our hope is. It's what we can do to keep technology honest and human.
Yeah. Well, and I think what, you and Steele and Susie and many people on this call, it is about keeping it honest, right? It is about reflecting on the work that we're delivering and saying, how can it improve? And talking to others and saying, here's where we're at, here's where we want to be. What are your ideas on how we get there? And I love this idea of, I think many of us are developing or have integrated peers on our boards and in our work, but there's still room to grow there too, in terms of getting better at that and listening to each other and understanding each other's position, vocabulary, all of those things. And so I really, I feel your energy. I really feel your energy, and I feel from Steele a quiet presence push as well. And I think that those are so valuable on our teams these days. Those both bring hope in a different way, right? And I really appreciate that so much from the two of you and from Susie and from the people in the work that I do who are peers with lived experience. And like, I loved what Susie said, we have all kinds of different lived experience, right? There's all kinds of things. And you kind of touched on that in your explanation as well, all the different parts of your life and where you've lived, you bring all of that lived experience forward. And so really appreciate you and Steele coming forward today. I think you're going to see in the comments when you have a moment to look, a lot of people may have questions or kind of are cheering you on. So we really appreciate both Bianca and Steele coming forward today, and Susie for kind of the overview to introduce the work that you are all three doing. So thank you so much for coming to the Jam today. All right. Like to bring forward John Palmieri for our SAMHSA update, and also Sammy nominee.
Thanks, Amy. Thanks for slipping that in there as well. So good to see everyone today. A few things I wanted to highlight for the SAMHSA updates this week. One is that people may be aware that Vibrant, obviously the Lifeline administrator, recently released their RFP for video-based services for people who are deaf or hard of hearing. This is something that has been a priority for us in expanding Lifeline services for that community. So very excited that that RFP is out on the street with a deadline pretty short turnaround. I think it's within the next couple of weeks, but I'll put the link in the chat for people to take a look at that. Related to funding, I know every week we've kind of been talking about our 988 office notices of funding opportunity, but just also wanted to make sure people were aware that those are still open for applicants. So there's 3 programs there, one for states and territories, one for tribal nations and tribal organizations, and then the other for Lifeline Crisis Centers to expand follow-up activities. And so those are all, as I mentioned, still open for submission of applications. 2 of them through the end of June, and then the tribal one is actually mid-July. Amy, you did mention the roadshow. So the 988 office and our director, Monica Johnson, along with other SAMHSA and HHS leaders, are doing a tremendous amount of engagement around the country related to the 1-year anniversary of 988. As you mentioned, they are currently in Austin, and there'll be additional activities forthcoming in the coming months. And these visits are intended to obviously build awareness and excitement around the 988 anniversary. And at the same time, it's also an opportunity to spotlight and emphasize local innovation in particular aspects of the crisis continuum, whether that's 988 911 coordination or mobile crisis dispatch or stabilization services and so forth. And so in addition to focusing on the 988 implementation itself, this is also an opportunity to sort of broaden the lens and look at that crisis continuum more broadly and how 988 fits into that continuum. I also just want to 2 other quick things. One, this is not new and it's not specific to crisis services, but I do like to point out when things are happening among other federal agencies. And so in April, CMS issued a final rule on Medicare Advantage. And for folks who want to take a look at that or have seen it, they will see that there is now a requirement that prior authorizations for emergency behavioral health care are no longer permitted through Medicare Advantage. And I'm just highlighting that because obviously there's not one thing here that's going to be sufficient in terms of how we approach financing and sustainability and access to care, but there are lots of small steps that are building a momentum in terms of how we drive change moving forward. And this is one example of that we'll continue to lean on our partnership with CMS and other partners to support some of these changes. And then finally, just I wanted to flag that we are internal to SAMHSA doing a lot of work in planning and thinking through our strategic approach to training and technical assistance activities. This is across SAMHSA as a whole, but certainly within the 988 office as well, recognizing that we had a number of very large scale national convenings over the past year and a half, focused on a number of issues that we know are important to sustainability, workforce, technology, and supporting crisis services. And so we are consolidating some of those efforts, and there'll be more to come soon on picking up some of those activities, opportunities for convening, opportunities for training, and so forth moving forward. So I'm very excited that we actually are in the process of securing more infrastructure to be able to move those activities forward. So I think that's it for me, Amy.
John, thanks so much. And I noticed in the chat, a couple people would love for the roadshow to come to them. So if in coming weeks we can hear where the roadshow is coming a few weeks in advance, I think people would be thrilled to know when they're in their neighborhood. So
Absolutely.
Thanks so much.
Sure.
Okay, wonderful. I'm going to turn it over to Megan now from Nashville, and would love to hear an update. Thanks, Megan.
Great. Thank you, John. Thank you so much for your update about the upcoming RFP. I actually was going to highlight and am going to highlight an upcoming crisis jam that's going to address effective communication planning and response with deaf communities for 988. We're just so excited about this RFP, and the presenters for this crisis jam will be Steve Hammerdinger, the director of the Office of Deaf Services for the Alabama Department of Mental Health, as well as Olivia Stein, who is the director of video phone crisis line services for Deaf Lead. And Steve is going to provide a national perspective, and Olivia is actually going to provide an example of what a video phone crisis line call might look like. And so that crisis jam takes place Wednesday, July 5th. We hope you all can join us. So excited about that. Also wanted to highlight an upcoming webinar. It's a 4-part webinar series sponsored by SAMHSA through the Technical Assistance Coalition, administered by NASHBID, and it's entitled Leveraging Different Sectors to Address Youth Mental Health Crisis. And hold on. And the Association of State and Territorial Health Officials, ASTO, and the National Alliance on Mental Illness, NAMI, have partnered to develop that series, and it focuses on the role of multiple sectors in addressing comprehensive youth mental health and well-being. And so the first webinar of that 4-part series is titled The Root of Poor Youth Mental Health Outcomes, How Public Health Goes Upstream and Convenes Cross-Sector Partners. And that takes place next Wednesday, June 21st, from 2 o'clock to 3 o'clock Eastern Time. Victoria Pena on NASHBID staff will be putting that flyer in the chat box, and take a look, and we hope that you can all join us for that. Thank you.
Thanks so much. And I wrote in the chat, but just want to say out loud, Megan, we continue to appreciate you bringing forward aspects to support the deaf community, because of course, we all think about we need to include the whole community, and I appreciate you continuing to spotlight that. All right, well, this brings us to the data corner, which personally, I wish we could have even more often, Matthew. We just don't have it enough. And I appreciate that I recently saw you in person in San Francisco. What a thrill that was for me. So I want to hand it over to you to let us know what we're going to hear about on the data corner today.
Great. Thank you, Amy. It was great seeing you in San Francisco as well. So I'm really excited for this month's Data Corner to introduce Jonathan Pirtle, who is a friend and colleague and really a national expert in all things mental health policy. He's written extensively on various topics, and recently with 988 gaining so much attention and crisis services really becoming front and center in a lot of policy discussions nationally in the mental health space, he's taken an interest in studying crisis policy, which I was thrilled to hear that from him and to get to partner with him in this work. So Jonathan is the Director of Policy Research for the Global Center for Implementation Science at the NYU School of Global Public Health, and he's also an Associate Professor in the Department of Public Health Policy and Management. So really excited to hear from you on your recent research. Thank you.
Cool. Thank you so much, Matt. And hi, everybody. Honored to be here at the Jam. I love the Jam. So cool. So real honor to be here. So I've got 3 slides for you from a recent study that will be coming out within a week or so, I think. So high level, big picture. So in this study, we did a few things. So first here on this slide, these are state level differences in the magnitude of increase of call volume expressed as a percentage across states following the launch of 988. So here we're comparing the same 4 months in 2021, obviously pre-988 rollout, and 2022 post-988 rollout. And the thing we want to illustrate here is there's wide state variation. And of course, there's a caveat. There are many caveats. One of the important ones here is that, these are only 988 call centers, of which there are about 200 across the US. A recent NRI survey found there are about 300 non-988 affiliated call centers across the US. So they are not contributing data here. But I think this can be valuable just to see there's pretty wide between state variation in the magnitude of increases in call volume following the launch of 988. So this is only through November. That was the most recent data we had access to when we ran this. We're going to keep doing this and updating it. Next slide, please. So here on this slide, we're still focused on the magnitude of increases in call volume following the rollout of 988. But here we're turning it into dollars and cents. So here on the y-axis is the estimate of the additional amount of money per state resident that will be needed every year to accommodate the increases in 988 call volume observed. And on the x-axis down in the bottom, instead of the percent increase in call volume, this is the rate per 100,000 state residents. So here we use the SAMHSA estimate of $82 as the cost of a single 988 Lifeline call that was provided in the appropriations report. That estimate is only for the calls, right? So it doesn't include mobile crisis. It doesn't include crisis stabilization centers. So absolutely an underestimate. But what the best estimate that we have right now, $82 per call, We see again this wide state variation and getting some sense of the magnitude of cost per state resident annually if these increases are sustained. But again, these are only for 988 call centers. I cannot emphasize that enough, not crisis systems more broadly, which is of course what we want to see. And final slide. So here what we're doing, we are comparing the increased cost, the total increased cost per state resident for the increase in call volume. And we're comparing that to the amount of money going into states that has explicitly been earmarked for increases in call volume to call centers related to 988 rollout. So to do that, we looked at the variety of legal mapping databases that are out there by Crisis Now and NAMI and some vibrant data. And the best we could for the states up here at the top, we were able to get some sense of how much money states were putting in explicitly for call centers in the context of 988 rollout. And we're comparing that to the cost. And we're doing this two different ways. On the green lines, we are including the state 988 capacity building grants in addition to the state funding. And those are the green lines. The blue lines are only the state funding. So when states are below that line there, that means there is more money than needed for our calculations. And again, this is only for Lifeline call centers. And when we get above that line, there is not enough money per state resident coming in. Lots of caveats, which we talk about in the paper. It is challenging to really count the dollars coming in specifically for Lifeline call centers from states. In some states, it's pretty easy. In some states, it's pretty much impossible. It all has to do with budgets and how things are written. But again, just kind of approximations and trying to get a sense of demand and also money coming in to meet that demand. As I said, the paper will be coming out soon, but I'm happy to send you a copy if you want it now. Shoot me an email. And thank you so much. Happy to be part of the jam. I appreciate the opportunity.
Jonathan, don't disappear so quickly. There may be a question or two. And I think,
Yes,
Matthew, do you want to come on, and is there any reflection on Jonathan's paper?
Yeah,
Whenever
I mean,
yeah.
I
What
just
do you
want to,
have?
I would just say, I mean, part of what makes Jonathan's work so compelling is that, you know, these are data that can really inform policy. It's not just that he's studying policy, he's really finding data that can directly, you know, communicate to lawmakers, to advocates, you know, what do we need to do differently here to serve the need? And so I think that the sort of conversion of demand to dollars and cents is very important. But yeah, I do see a couple questions coming in. I'm happy to hand it to you, Amy, if you want to moderate a couple of those, depending how much time we have.
Yeah, and Jonathan, I think look through the chat, because I think people have questions about your paper, which of course I can't answer because this is way above my head. But the one thing that, like, anytime I see things that say we're pouring too much money into something makes me worried, because we know that the volume and things are going to change, right? So is your plan to kind of repeat this at some point in the future?
Yes, that is the plan. So with support from NIMH, we have a 5-year project, which is really focused on state financing for 988 rollout. So we're going to continue this legal mapping study over time for the next 5 years, really focusing on spending and trying to, you know, quantify the inputs going in for 988 implementation. And also working with Vibrant's a partner in this work, looking at call volume rates, in-state answer rates, and things like that. And also in the study, we'll ultimately going to be connecting spending and financing strategies to outcomes related to emergency department utilization for mental health crises, suicides, death, and stuff like that down the line.
Jonathan, excellent work. Someone like me who always wants to know about the money part, but doesn't know how to do these numbers and algorithms that you do, really appreciate this kind of work, and for you to simplify it so that it's digestible for the rest of us. So thanks for coming. I'm sure we're going to want you back on the jam. So appreciate it, and have a good rest of the jam today.
Yeah, thanks.
All right. Crisis talk. So we're going to bring forward Sue Murray. I know it's early, Sue. Appreciate you being here. I want you to know, if you can believe it, we've had over 200 interviews as part of this segment so far. So you are, I know, someone we've had a couple times, and really look forward to what you wanted to talk with us about today. I think we have a couple minutes for you.
Great. Thanks so much. Look, this week's article is on who is caring for the healthcare workers. I think it's very common. We all know that health services across the globe are struggling to fill staffing vacancies. And often health professionals have experienced very challenging and toxic cultures which do not give them confidence that if something goes wrong, the organization has got their back. More often than not, it's completely the opposite. And it can result in us losing highly skilled and experienced health professionals. And that's a really severe blow to the health system. So every day we know health professionals apply their knowledge, practice their skills within very complex situations. At times the result is there may be unintended outcomes for the patient. And certainly the people who are impacted by these unintentional errors are the first and obvious victims of the medical mistake. However, those that care for them are also wounded by the errors, and they have needs which must be met. And oftentimes those needs are not met. So in this week's article, I interviewed Professor Sydney Decker, who is a world-renowned expert on restorative, just and learning culture and building psychologically safe workplaces. And also Dr. Catherine Turner here in Australia, who's led the successful implementation of the Zero framework within a just and restorative culture. So we've discussed the importance of understanding errors, reactions to failure, and how restorative, just and learning culture underpins the implementation of the Zero framework, Zero Suicide Healthcare framework in Australia. For a restorative just culture, it identifies and sets out to repair the harms that have resulted from an adverse event. It asks about the impacts, the needs, and the obligations. It also holds people accountable in a forward-looking way to try and understand what do we do now to heal and improve. It is highly reliant upon leadership, and leadership needs to take action to diffuse, empower, and follow up. And what that all means, you'll have to log on to #CrisisTalk and read a bit more about it. Thanks very much.
Thanks, Sue, for joining us today, and stay warm. I just looked up the temperature while you're talking. It looks very chilly. So happy to have you this morning, and looking forward to the interview. Thank you.
Thank you.
All right. Representative Orwell, I hope you are here. Want to bring you forward. I think I've seen pie charts or things where you're like our most frequent person on the jam. So you know how to do this more than me. So I'm going to sit back and listen to you.
Well, thank you. I'm like your biggest fan. I'm a groupie, so it's great to be back. It's an honor, and an honor to give you an update around the work in Washington. And of course, it's a big team. I don't know if you can go back to the first slide. I wanted to show one of the team members from Washington. In the corner there, we have a 988 emblem, and it says there is hope. And holding that sign is Alfie Alvarado, who is one of my mentors and our director of Veterans Affairs, who just retired. But the proceeds will go to veteran suicide prevention, to peer-to-peer programs. So very proud of that. Next slide. Okay, this is hard for me to talk about because I'm going to cry. This was a story that was done on one of our local stations, and Danny had been texting into the chat line, and that incredible 988 worker was able to tell him what he needed to hear during active potential suicide. And he shares his story. And I just want to say thank you to everyone who's on this call. And please know the work you're doing is making a huge difference. It's saving lives. And just want to say a thank you. I'm really proud of our call areas, our 98 centers. They're doing great work. Next slide. We had some dark days and continue to in Washington State. We have huge issues with boarding, and not only adults, but children. Spending hours in our emergency departments, no windows, sometimes strapped to gurneys. We have people going to jail who really need treatment. And so 988 really has been our moment to really create a trauma-informed and healing system. And so, again, you know, we're moving in the right direction. It's going to take time, but there's so many important reasons to do that. So just as the backdrop, as you recall, Washington State, we passed House Bill 1477 a few years ago. We did do the fee. The fee started at 24 cents and it went up to 40 cents this January and brings over $50 million a year. We were able to double and sometimes triple our call staff. We have 3 great 988 lines. We also have the first in the country tribal line called Native and Strong. And so big shout out to our call centers. Next slide. So this session, we really focused on next steps. And many of you know, I love the Beatles. And so there is a Beatles song that really is about the next steps. And it was on the flip side of the 45 single, and it is Come Together. And that's what we're trying to do. The 2 bills we had really were about next steps. The bottom one there is Senator Dingra's 23-hour crisis center. We're calling them now the crisis relief centers. People wanted to know why we're closed 1 hour a day. So there was a lot of confusion. It's based on the Arizona model. But the bill I introduced was really heavily influenced by our 988 lived experience group. And we kept hearing over and over that we really want a clinical response when someone's in crisis, whenever possible. And so we really wanted to create what we're calling a rapid response teams. And we want that to have clinicians, people with lived experience, and maybe partnering with AMS and fire in certain areas. So I'll talk a little bit more on the next slide. This is a visual that my social work intern did, Hollis. I have to do a shout out. But again, we're also doing some co-location of 988 staff in some of our 911 centers. And part of the purpose is to bring more calls back to 988. And I've sat in those centers and they get a lot of mental health calls. They have tough jobs. We want to get those calls back to 988. And we want that small percentage of calls that need a dispatch to be a clinical team. And we have 30% of those funds going to the tribe so that the Native and Strong line can have teams attached as well to go out. Next slide. And so how do you do a rapid response? This was very difficult. And one of the things we really needed to realize is that an urban area and suburban and rural need to look different. And so what we really did was try to kind of tailor the timelines. And we did an opt-in system where you get an enhancement with the $988 to be paid more for when you actually meet those outcomes. So we're going to be stepping into this system. But again, if someone's in an urban area and we want to be a true alternative to the police, we need to have a rapid response. So we're really proud to be doing that. And again, it's going to take us a year and a half, 2 years to get up and running, but we think that's the system that's really going to be trauma informed and save lives.
Representative Orwell, I just want to tell you that what a pleasure it is to have the opportunity for me to be able to talk back and forth with the representative. That's not something we often get as constituents, to be able to hear from you and what you're thinking and how you're working on our behalf. It's a real privilege. So thank you for joining us today. Appreciate it. So we're not going to have a federal update today, but we are going to have state updates. So Shelley Polanco.
Thank you, Amy. So just quickly wanted to highlight Rhode Island has a bill that appropriates $1.875 million in federal funds for the state fiscal recovery fund to maintain a consistent level of 988 and crisis behavioral health services. So they're having a meeting today. Also Pennsylvania, they had a fee bill that was heard last week. So the fee is 6 cents per 988 and a 988 trust fund. It was reported out the House and Human Services and it was voted 14 to 7. So we're waiting to hear back from the next steps on that. And I'll forward it to Stephanie from NAMI for another update.
Yeah, thanks, Shelley. Just one other new piece of legislation I wanted to touch on, which is in Delaware, House Bill 160. So there, the House Majority Speaker, her name's Valerie Longhurst. She has introduced a 988 implementation bill, really sets out the vision for 988 in Delaware, does leverage that telecommunications fee to support the system and establishes a trust fund that's already received its first hearing and been moved out of its first committee. So we will keep an eye on that. And that wraps up the state update for today.
Hey, I appreciate that. Thanks so much. For those of you who haven't seen the individual Moving America's Soul on Suicide videos, good news. We're stitching them all together to be a documentary. So they're coming soon, probably in about 2 months. And I'm really looking forward to that because I think it's such a powerful series that we can use in teaching, training, etc. So it's going to have a lot of utility, and I'm really looking forward to seeing that. All right, so what's coming up we wrap up today? Next week, we're going to have Haley Van Aram on the ADA Act and mental health. That's going to be a really good one. Really, she's from the Department of Justice's Civil Rights Division. I think that's going to be a really good one that we're going to learn a lot from. The following week, we're going to have Shelley Curran, I think. Maybe I just do it from my memory. Shelley Curran the next week. Yes, in 2 weeks on fundamentally transforming crisis care in Arizona. And fun fact, Shelley Curran was actually our very first featured presentation on the JAM. So coming full circle with her. And she's going to be talking about capacity and really talking about taking these ideas that we have around 988 to scale. And that's going to be a good one. A lot of people have questions about that. So as we wrap up today, I want to thank Jenna Baker for being on the hot seat today. Susie Reese, Steele Kelly, and Bianca McCall for reminding us about peers as partners and experts who join with us on this journey. I want to thank Jonathan Pirtle for making complicated money and policy issues digestible for the rest of us. Sue Murray for joining us from halfway around the world, talking to us about healthcare and taking care of our workforce. And of course, Representative Tina Orwell for continuing to update us just on what she's doing in Washington and how we can take those into other states and improve what we're doing. Thank you so much for joining us today. See you next week on the JAM.